All right, welcome to Live Well with UCI Health. I am Ryan Manna with Coast 103.5 and iHeart Radio. Thrilled to be joined today by Dr. Don Young Park. I don't want to mess up your title, Doctor. Director of the Advanced Endoscopic and Outpatient Spine Program here at UCI Health. Doctor, thank you so much.
Well, thank you for having me.
Thank you.
I really appreciate it.
Really appreciate you. It's a pleasure to meet you. Tell us about you. I know I saw Stanford in there.
Yes, I did my training at Stanford, did my orthopedic surgery residency for spine surgery fellowship there.
Yeah, and I know that you're one of the leaders. People call on you a lot for you're an opinion leader, as they say.
Mm-hmm.
Is that right?
In endoscopic spine surgery and minimally invasive spine surgery. So one of my other titles is I'm the director of the minimally invasive spine surgery at UCI Health.
Yeah. How long have we been at this in the game?
13 years now.
Yeah.
I graduated fellowship in 2012.
All right. Way to go.
Thanks.
And I know, see, there's a couple things, like you can live with, like if your finger hurts, that, kind of ruins your day for a little bit. But like when you have back pain, there are a few things in life that are more debilitating. When your back is whack, like it throws off everything, right?
That's correct. It really does affect everyone's activities, their daily function, their enjoyment, the quality of life. All of that's affected. And a lot of people are talking about health span. I think back pain has a lot to do with health span. Yeah. And so if you have debilitating back problems, then I think that it's going to completely affect your life from beginning to end.
In your practice, in your study with what you do you find there's something predominant that leads to back pain?
Injuries, that's one, but it's multifactorial. So you can have injuries like a sports injury. Sure. You can have genetic predisposition. Some people are more prone to it. It runs in families sometimes, and then I think wear and tear. Sure. What we do to our bodies, and so if we're really hard on our bodies. If we put a lot of stress and strain into our spine and our bodies, and it will be affected by it. Yeah.
I've always heard that there are a couple things you shouldn't skimp out on. It's anything between you and the ground, your shoes, your mattress, and your tires on your car. And I bet a bad mattress and bad shoes, if you're like a runner or if you're on your feet all day, that can over time contribute to some back stuff.
Definitely. And one of the things I always recommend is having really good shoes. And I see a lot of these new shoes and new brands, and everyone's wearing them now because of that. Because it does translate up, from your feet to your legs and to your back. Yeah. So, okay, by the time someone comes to see you and they've exhausted all options, right, for treatment, and surgery has been recommended, what is your guidance? Well, I first look at the patient symptoms. Okay. I get good history, understand what happened with the patient. What have they done non-surgically to treat it? Have they exhausted all non-surgical treatment options that is reasonable, for the patient? And many times patients have done rounds and rounds and rounds of non-surgical treatment, and they're kind of like, this is the last resort, which is, I think, a very reasonable thing to think about. Many patients come to me and they say, I wanted to avoid surgery like the plague. Sure. Right. I never wanted spine surgery ever. Yes. And, when they hear about what I do, then they're intrigued. They're like, oh. And one of the things that the patients always tell me is that, well, I want that non-invasive surgery. Yeah. I was like, well, that doesn't quite make sense, but I know what you're talking about. Sure. And what are they talking about? Yeah. They're talking about endoscopic spine surgery, this ultra minimally invasive spine surgery that I do. Yeah. So how does that work? I mean, how minimally are we talking? These are millimeters. So millimeters. Ultra minimally invasive is the kind of like the next evolution of spine surgery. So we've gone through this phase. When I was in residency and fellowship, it was minimally invasive was kind of the big thing. Yeah. And that's incisions of centimeters. Sure. So maybe 2-3 centimeters incision, and it does wonders. Okay. A lot of patients do really well from that. Yeah. But now we're talking about millimeters. Okay. And so several millimeter incisions. So these are really, truly small incisions where sometimes I can't even see the incisions on their backs. Like, where did I do surgery? And I'm embarrassed to say it, but they'll call me a magician because I feel like, I'm doing magic, but I'm really not. I'm really doing feel like surgery. I'm sitting with a magician right now, learning this. That's what they're calling me. And I'm like, no, I'm not a magician. I'm actually doing real surgery. It's just that the technique allows me to do the things I need to do to treat the patient and undo the pathology has been growing for years inside their spine, inside their bodies with these tiny incisions.
So on a very literal level, put this in terms for people that aren't in the OR with you and aren't seeing what you're doing. When you make these small incisions, then what? Like, are you going? What are you using? What are you doing?
So I put in a camera. So
Okay.
it's now we have like 4K, high definition, TVs everywhere, right?
Yeah.
And I can put in 4K cameras into the spine and with an endoscope.
Mm-hmm.
It's the one that I use is about 4 millimeters in diameter, and so then I put that into the spine. And then I'm able to visualize the anatomy. I can see everything in 4K.
Okay.
And it's underwater. And it's very similar to arthroscopy.
You're blowing my mind right now. You do surgery underwater?
Yeah, underwater.
Okay. All right.
And sometimes myself with all the water that spills on me, but then literally underwater in the spine.
Uh-huh.
And it's very similar to arthroscopy. So if you do knee surgery,
Sure.
shoulder surgery, even now hip, hands, orthopedics is now a large part arthroscopic.
Wow.
That means you're in the joints.
Yeah.
You're putting a camera in the joints. Endoscopic is putting a camera in the body somewhere. It could be, in your gut, but here I'm doing it in the spine. And so I put the camera in the spine, and then I'm able to visualize with extreme visualization.
Mm-hmm.
I can see really well the anatomy. I can see the nerves. It makes me a safer surgeon. So I know with, 200 times magnification
Yeah.
that, that structure is not to be touched. I need to be preserving that. And it's safe to do the surgery that I do to really kind of decompress or fix the problems that the spine is going through.
Yeah. And let's talk about those problems. What I don't know about most common, but what specific, spine conditions can be treated with what you're doing?
Right. So common things like lumbar disc herniations.
Okay.
These are things that happen to young people.
Mm-hmm.
People, weightlifters, football, high school players who, are deadlifting and they tweak their back and get a disc herniation. These are patients
Brutal.
that I see all the time.
Yeah.
And then older patients as well. So as people age, their discs degenerate. That degeneration causes arthritis. That arthritis can then lead to compression of the nerves and what's called lumbar stenosis.
Mm-hmm.
That lumbar stenosis can then lead to symptoms like pain in their legs, like sciatica.
Yeah.
And that kind of sciatica pain can be treated with this as well. Other things that I can treat is common things like slippage of the spine, where the spine is unstable and it slips back and forth abnormally.
Mm-hmm.
And so that's something that I think can be treated as well endoscopically. I can even do what's called an endoscopic fusion. Now, a lot of people have this notion that fusion is all bad.
Yes.
And actually, if you look at the studies, the randomized clinical trials, the evidence out there, the best evidence we have shows that fusion actually works really well for certain things. And if you apply it in the right way, then fusion is actually a very successful surgery, and it can lead to long-term success.
What can you tell me? I've heard this, because I follow sports a lot, right? And you'll hear of athletes who've gotten like a C something fused or whatever. What is fusion?
Fusion is when you fuse the bones together.
Okay.
So typically in the spine you have a vertebra and a disc and another vertebra. So there's the disc in between is what helps it move. It's like the cushion between the bones.
Mm-hmm.
And so sometimes that disc is so degenerated and so dysfunctional, and it's causing problems. Like say the inside of it.
Mm-hmm.
Imagine like the inside of your tire.
Sure.
Right. It kind of popped out.
Yeah.
So then same thing can happen with your discs, where the inside of your disc pops out, and then it can push on things around it. And around it is actually sometimes really important things like your nerves,
Yeah.
your spinal cord,
Okay.
things like that. So
it's like one thing leads to another, right? It's like this thing is impacting this other thing, and
right.
yeah.
Right. And so then you have to then remove that dysfunctional disc and remove the compression of whatever it is that's being compressed. If it's a nerve, if it's the spinal cord, then you remove that compression, and then you have to then fill it with something else.
Yeah.
You have to fill that space where the disc used to be. Now we have things like disc replacements.
I'm envisioning like an Oreo without the cream in the middle.
Right.
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 So now we're filling it with what? Just the other, we're fusing the bone.
So we can't put in the cream back in. So that's the hard part. We're still trying to figure that out.
Yeah.
But we take the cream out.
Okay.
You take the disc out, and then we have to fill it with something.
Sure.
So then we put in like a cage, like some sort of implant, a disc replacement sometimes. So you can do that.
Yeah.
And so there's different ways of treating and addressing disc pathology.
Sure. Okay. So with you, with your magic that you do in the millimeters underwater, how does this compare to, let's say, traditional, old school spine surgery or regular, not what you're doing in terms of recovery?
Right. Because many surgeons, I say the vast majority of surgeons are still doing traditional surgery.
Where they're just like cutting open the back and stuff.
Right. And that's what it is, cutting open the back.
Yeah.
So you make a big incision because you want
How big? Like typically?
It depends. Depends on what you're trying to do. It could be as big as, your back, from the top of your back to the bottom, of your back, to you may do scoliosis surgery.
Okay.
Where you have to put in lots of screws and rods and fuse all your bones from the top to the bottom.
Oof.
Or it could be just in your lumbar. If it's just in your lumbar, then it's like it could be 5-6 inches. So it still could be a sizable incision. It's not the size of the incision that really is the issue.
Okay.
It's what you do inside. So when you do traditional surgery, you have to make an incision. Then you have to detach all the muscles that are on top of the spine. Then you have to then retract those muscles so that I can see what's going on, right? So traditionally, I would use loops or those magnifying glasses that you use in surgery, or a microscope, an operating microscope. But you're looking at it from the outside. So I'm looking at it through my lenses. My eyes are on the outside looking toward the spine. And so I need a big incision to see.
Sure.
Like, I need to know what's what, because I don't want to injure anything. I don't want to damage anything. And so that retraction of muscles, it's been shown that really does lead to a lot of issues. So the muscles, they can die off because they're denervated. You basically took all the nerves that go to those muscles and you stripped them off. You took them off the bone, and then you retracted under high pressure. And for an hour, 2 hours, 3 hours, 4 hours. So then you undo that, and then there's no blood supply to that muscle. So those muscles die off.
Yeah.
Right. And then you sew everything back up. And then over time, what ends up happening, the fusion, say it works great, it's fused, but the muscles are dead. The muscles are gone. Right. And the muscles are what you use to stand and what you use to change positions,
of course,
lean forward, lean back. And so because of that, those muscles are super important for your long-term back health, right? And I'm always telling patients, you need to work on your core, your back muscles, your leg muscles. That's the trifecta for good back health.
Yeah.
But if you remove one of those, then you can really kind of tip things over on the balance in terms of back pain. So then you can get what's called chronic back pain from that because your muscles are atrophied, they're dead, they're not there anymore to help you stand. So that's one of the big issues of conventional spine surgery, is that you have to first see everything, but you have to retract everything. So what I do is I don't do any of that. I go between the muscles, the little muscle fibers, and I don't detach any of it. I don't denervate anything. I don't retract anything. I don't put anything under pressure. And I create a space over the spine, and then I fill it with water. Okay. And then it's like a little water bubble on top of the spine, but everything's still intact. The muscles, the skin, everything other than those little tiny incisions to do the actual surgery. And then inside there, I put the camera in that water bubble and put the surgical instruments inside that water bubble as well. And then I'm able to start the surgery. And I can see the same kind of anatomy that I see when you do it open, because I've done all of that. I've done open surgery, I've done minimally invasive surgery, and I can see it, but under such good detail that, I think that you're able to really understand the anatomy quite well, and be able to accomplish the surgery. And that's one of the things people actually ask. They're like, well, with minimally invasive spine surgery, you can't see as well. And then with ultra minimally invasive spine surgery, you can't see even.
It's even worse.
It's even worse.
Yeah.
It's actually not true. Because I have this 4K camera that I can put inside the spine. So imagine the eyes are now in the spine, not outside in the environment. And so I can
Wow.
see so much better than when I could without it.
So okay. So what about recovery time? Like for your standard,
Right.
Are they at home that day?
Yep. So
Oh my God.
That's why my program is called the endoscopic and outpatient spine program. So you're combining the two, so patients can go home the same day. And these are patients that are even older patients, elderly patients, that can go home. They're up right away. Most patients wake up from these kinds of surgeries that I do with no pain. And then they're able to walk right away.
Instantly, they know they have no more pain.
Right. I ask them all the time, how much back pain are you having?
Yeah.
Like, none?
No.
And they're just kind of surprised.
Yeah.
Like,
They're playing pickleball that night.
No.
I'm just kidding.
I don't want that.
No, I'm kidding.
In orthopedics, pickleball is...
Is it bad?
Yes.
Really?
It's one of the things that helps us stay busy.
Okay.
So, yeah. And
wow.
I wouldn't want them to play pickleball right away.
Yeah. That is fascinating.
Yeah.
You're shedding light. Okay, so let's go back to this like eyes inside the spine, because there's something you do, and I really want to geek out with you over this. You have worn an AR augmented reality headset to do your surgeries.
That's right.
And it was a first. It's a first.
So I did the first in the United States.
That's
I did
unbelievable.
In terms of the using the augmented reality glasses for the endoscopic spine surgery.
Yes.
And then I did the first AR guided fusion in the world. And so that's where, it's really been a game changer for me. And the reason is it's like having a really enhanced virtual view of what's happening.
Right.
It has the ability to capture my environment as well as have large videos in front of you. So it's like having a 100-inch TV monitor right in front of me virtually.
Yeah.
But with 4K. And there's 4K on each eye. So then I can see so much better, because the screen is so large.
Yeah.
And what's great about it too is that I can also put in other things like the medical record. I can virtually place it there. I can place the preoperative MRI, put it next to me.
In the headset, so you're seeing
I can
this
just look around and see, oh, there's the endoscopic video. Okay, what was it about that patient that then you can then, what was that MRI look like? I can look over here. And so you can see all of that right away, and so the information, the data is at your fingertips.
Yeah.
Or literally in front of my eyes. And I don't, what I had to do before, if I had a question about something, I don't really know what's going on. Like, I'd have to step away from the patient, go to the nurse's station,
Yes.
look at the computer. Hopefully it didn't log off. Log back in. Yeah.
Yeah.
Because I'm scrubbed in.
Yeah, of course.
I have to log back in somehow and then look for that information. Whereas now I'm still doing surgery and I'm looking around at that information. So it makes me more efficient. It makes me safer.
Yeah.
I think that's the future, part of the future of spine surgery and surgery, I think, in general, is this augmented reality.
Are people coming to you now asking for this?
Mm-hmm.
You have people, obviously they would want this.
Yeah, I have surgeons, from Taiwan, from Korea, from China. They're asking me, how did you do that? How are you doing this? From Japan. And so then I'm showing them how they do it. And then I think it's growing slowly. So we'll see. I think there's still a lot that needs to be done in this space. It needs to be lighter.
Lighter? What do you mean by that?
The headset.
Oh, the actual headset.
The actual headset needs to be lighter.
Okay.
It needs to be faster.
So that's AR. How do you feel about AI in the future of AI for what it is that you do?
Well, I think AI is going to be huge in terms of combining AR and endo. So in my mind, and what I think of the future is that AI will be able to tell me as a surgeon, all right, if you do the next surgical move with this instrument and put it into this area, predictive analytics says 1 million moves, this is the fastest and the safest way to go.
Whoa.
So if it told me that, it's like giving me the answer key on like, okay, I'm going to do that.
Yeah.
Because surgery, like anything, is a series of decisions.
Sure.
Right? So if you make the wrong decision the wrong time, you're going to go the wrong direction, right? So you want to have the right direction. And so having AI to help me in terms of getting the right decisions, the right path to success and making it the safest and the most efficient way of doing it, that's where I see AI. So if in the headset, if AI is saying, okay, you want to go to this area in the spine and you want to take this instrument and do this with that, then you're going to be safe and you're going to be effective. You're away from the nerves. You're not going to injure anything. And so for me, that would give me a lot of reassurance.
Sure. But okay. So, and I'm not being funny when I ask this. Your human brain, do you ever disagree with what AI is telling you, or do you look at it as like, okay, I think that might be right.
Right. Yeah, I think that I probably would be. It's kind of like sometimes I think Google Maps is wrong.
Like, no, I'm going to go right.
I'm going to go that way.
Yeah.
You know, it's like, I don't think that.
Yeah.
You know, sometimes
that's so fascinating.
I think that the technology is just not, correct.
Yeah.
Sometimes I'm wrong about that. And
sure.
so, but that's my decision. That's
Okay.
the human decision to be able to discern.
Yeah.
Now, when people are afraid of AI, they're afraid of AI taking over and just doing everything.
Of course,
right?
yes.
It's like, they're never going to be able to do the surgery by itself.
That's right.
Because who's going to be responsible?
Mm-hmm.
Like OpenAI or Apple or like no one is going to then be responsible. I have to be responsible. So ultimately surgery needs to be done by the surgeon. Now AI can augment me. I can use augmented reality to augment me, right? So I think that's where these technologies come into play in the future.
Yeah. So, okay, again, I want to go back to the folks that are benefiting from everything that you've just described. How do you determine, we've talked about opening up the back, we've talked about the different types of, how do you determine if what you're doing is best for that person versus something else? Yeah.
So I know what pathologies are best suited for the patients that I see. And so if I see something that I'm like, actually maybe open surgery, traditional surgery is better for you.
Really? So you have and would and do suggest that?
I do.
In those cases.
Right. And, maybe doing multi-level fusion is actually the best thing for you because your pathology is just too much. It's like endoscopic surgery is not for everything. It doesn't solve everything, but it does solve a lot of the most common things.
Right.
But there are those outliers. It's kind of like a bell curve. You're going to have some people where you just can't do that.
Yeah.
And so then you have to do, what's tried and true, which is more traditional surgery. And I, recommend that every once in a while.
Sure.
But for the vast majority of patients who I see in my clinic, they actually can have the surgery and they can benefit greatly from it. Like I said, they wake up with no pain, they're walking right away. 2 weeks later, I see them in clinic and they're like, yeah, I feel great, and they start physical therapy. Oftentimes by 6 weeks after surgery, they're like, okay, I don't want to see you again. I hope I never have to see you again.
I'm glad you brought that up because I wanted to talk to you about what I think when people do think of back surgery, spine surgery, any type of surgery on that area, the follow-up, what's the rehab, all of this stuff is like a concern, right? So what is your traditional, you said I see them in clinic. Like what does that look like for someone who's undergone what you do?
I see them in clinic in the before surgery as a consultation, make sure, are they appropriate candidates?
Sure.
And then after surgery, I'll see them usually at 2 weeks after surgery just to make sure that their wounds are healing and they're doing okay. And then I give them the physical therapy prescription. I think physical therapy is actually very important.
You do?
Because when people are in pain, they don't walk the same. They don't carry their body the same. Their bodies become dysfunctional. Right? They get out of balance. So then we need to rebalance them up again. We need to train them back into more normal life.
Yeah.
And so that requires, I think, some supervision, and physical therapists are the best for that. And so I do have most of my patients go through physical therapy, to be able to recover. And usually it's about 4 to 6 weeks of physical therapy that they go through.
That's not bad. I was thinking it would be longer.
No,
that's good.
Even the fusion cases, where it does shift. So the advantage of endoscopic surgery and ultra minimally invasive spine surgery is that it shifts the recovery so that it's sooner, right?
Yeah.
So you're in less pain after surgery. You recover faster. You can go home the same day or just stay overnight. Most patients are able to do that, and so it shifts everything so that you can get better faster, get back to normal faster, get back to your normal life, get back to function,
of course,
as quickly as possible.
Yeah.
And that's the basic tenet of this ultra minimally invasive spine surgery is being able to get there. The way we can get there is that it helps to reduce trauma, right? Our surgical footprint, the things that we do inside, is not as traumatic.
Yeah.
Right. So I don't have to injure the patient as much
Mm-hmm.
to do the same surgery, to accomplish the same goals.
Yeah.
And so because of that, they're not hurting after surgery, so they can recover faster, and then they can get back to normal faster.
Yeah. Feel free to brag on this because I have a feeling I know the answer. How many other programs are offering this level of innovation?
Just a handful.
Really?
In terms of endoscopic spine surgery, a handful in the country.
Yeah.
And then, in terms of augmented reality,
Yeah.
I'm the only one. And then, endoscopic fusion is like I was one of the first in the country to do it. And then, I think there's only a handful of programs.
Mm-hmm.
It's growing though.
Okay.
And I think that's where adoption will truly skyrocket with this, because most surgeons they're not trained in this.
Mm-hmm.
They're trained in conventional surgery because that's what the fellowships and the training programs, that's what they all train and teach.
Yeah.
And so once the training programs like UCI, like other university training programs around the country, like Stanford or Harvard or whatever, they get these kind of programs online and then able to teach the residents and fellows this, then I think it'll skyrocket. Because even now, when I teach my residents and fellows and I show them what endoscopic surgery is, and they see what conventional surgery is, it's like, well, I want that.
Yeah.
I want to do that because one, it's really cool. It's new, it's exciting, but also you see what the patients, how they do.
Mm-hmm.
They do much better,
Mm-hmm.
in terms of their recovery. And so they're like, well, if I had a choice, then I'd want to choose that.
Sure.
But if you haven't seen it, you don't know. So
Yeah.
if you don't know, then it's like, well, how are you going to make a decision on it?
Yeah. Yeah. On a personal level, what led you to this? What was your interest point, your entry point into
Right.
wanting to be like the king of backs?
Well, I first heard about endoscopic spine surgery probably in 2017,
Mm-hmm.
around then. That's when it was starting to really come up. And one of the places that it's like the epicenter is in Korea, South
Yeah.
Korea. And so, the South Koreans would then come and present their data, how their results were. And we're like, oh, that's too good to be true. And, I really have to learn this. Is this something that is real? And, you don't want to adopt something too early before,
Yeah.
the results really come out.
Sure.
And so I learned about it. I read the papers and I went to labs and courses and conferences about it and learned more and more as much as I could. Then COVID hit.
Okay.
Then I had a lot of time.
Of course.
I had a lot of time just to think about things and what about life? What's going on?
Yeah.
And what do I do next?
Yeah.
And so then I went to Korea and I learned endoscopic surgery from the masters that were at that time doing it. And, I was just completely blown away what I was seeing. I was, able to, just really grasp the ideas and the principles of endoscopic surgery. So I took that, came back to the US, came back on a Sunday, and then on a Wednesday did my first surgery, and then has been going since. So I've done over 600 cases now. I'm one of the first in the country to do the biportal endoscopic spine surgery that I mostly do. And then in terms of endoscopic fusions, I was one of the first in the country to do it. So I saw the potential, when I can see with my own eyes.
Mm-hmm.
When I went to Korea, I realized, okay, this is something really powerful.
Yeah, that's incredible. Just on a personal, for someone listening that may have not like something that requires a lot of, advanced care or this surgery, but like what are some good things maybe that you abide by in terms of just your own physical motions during the day? Like is planking bad for, like what's good and bad for you?
For patients?
Yeah, for anyone that's maybe dealing with like a sore back or something. Like
Right.
what's a good daily routine to be in for optimal back health?
Well, I think, like I said before, the three things that are really important are back muscles, core muscles,
Okay.
and your leg muscles.
Got it.
So you have to really have all three of those. It's kind of like the tripod
Okay.
to your spine
Mm-hmm.
in terms of spine health. So you want to strengthen those as much as possible. So planks are good. Sit-ups are not as good because if you're curling your back, is a tendency to really have bad technique doing sit-ups
Mm-hmm.
and crunches, and then you end up tweaking your neck, tweaking your
Mhm.
back. So it's not the best way of doing it, but leg lifts, Planks are great, and different exercises you can do with your legs while you're in the plank position. And while you're on your back with your legs lifted and moving in different directions, and different exercises you can do with that.
Yeah.
And then the things that you want to avoid. So you want to avoid stress to your back.
Okay.
The things that stress your back: bending deeply, twisting extremely, heavy lifting with your back, and then sitting for long periods of time. Those things really do stress your discs and your back and your spine. So you want to avoid that as much as you can. And so things like deadlifts, Olympic, lifts, those are really bad for your back if you do it poorly. And if you do it right, powerlifting could be great, for your body, but at the same time, it's not something that you can do forever.
No.
So it's always going to eventually wear on you. But you have to have proper technique, and most people don't.
Yeah.
And so I think that, proper posture, is really important, proper technique, and then also, keeping your body strong, and then avoiding the stress to your spine.
Sure.
All of that's really important.
Yeah. Do you hear back? Obviously, you follow up with your patients, but do they come back to you and say like, "Oh my God, you changed my life"? I bet you get that all the time, every day, right?
Every day.
That's incredible.
It's a great feeling.
It has to be.
And it really is the reason why I do this, and why I went into orthopedic surgery, spine surgery to begin with. Orthopedic surgery because you can fix a lot of things. You can really change people's lives. You can really make people better.
Yes.
Right. And the idea is to get people back to normal functioning, to get them back to where they need to be. And so that's where orthopedics comes into play. With spine surgery, what's exciting about spine surgery, and I've kind of geeked out about it already, is all the technology, all the tech, the high tech that you can have, AI, AR. We haven't talked about robotics. I mean, you can really combine all of that stuff into spine surgery, and that's super exciting too. And so I think for me, like that's why I went into going into it and into spine surgery, but also, not just the technology, but now it's also the results. Patients are coming back and they're just like, they're transformed. Their pain is gone. Their function is so much better, and they're able to get back to their lives or before surgery. And I always ask this in clinic, in every post-op visit. All right, do you feel better? Yeah. How do you feel compared to before surgery? Like, oh, this is night and day, like this is so much better. And so it's like, okay, then I did my job. And I feel like, I think that it makes it completely worth it.
Wow. Well, we are in the presence of greatness, sir. Keep doing what you're doing. I don't know where you go next from here, but it's really incredible, and you're changing lives, and really it's awesome, and a pleasure to hear your story and see what you're doing and all the breakthroughs that are probably yet to come, and that you're going to be on the forefront of. Dr. Don Young Park, live well with UCI Health. It has been a pleasure. This man is magical. I swear to God, if my back is ever screwed up, no one's touching it except you. Thank you.
Thank you very much.
Pleasure.